Thank you. I would like to call the meeting for the Neighbors of Dunn County Standing Committee to order and call the roll. We only have two at this moment, and I think I need to call Supervisor Story. If you'll give me a minute. I did get a text from her just now. She said waiting for call. Difficult for her. Good morning, Sheila. I have you on speakerphone and you make a quorum for us. We have Supervisor Wolf, Supervisor Story, and myself. Thank you for being there. At the time, let's see, we have approval of the minutes right now. And Supervisor Wolf moves. And thank you, Supervisor Story. Sheila seconds. All in favor? Aye. Okay. Was there any public comment, Chris? Nope, no public comment. I think because of our situation, we're going to skip 5 on the agenda and postpone them till next time. We'll go down to 6 on the agenda, Community Mentor Administrator Report. Quality Assurance Steering Committee. Chris Anderson?
Quality assurance. We'll pass on that one. I'm not sure what.
Okay, we will, thank you, Chris. We will pass on that. We moved on to 6B, Employment Activity Report.
Okay, am I on now?
You are.
Okay. So the employment activity report was in your packets. Recruitments have not changed. The county website, Neighbors website, NeoGov pushes that out to Indeed. So those are the 3 main ones. I would like to mention on that one, we do have a lot of applications that, or not a lot of applications that come in, but applications that do come in word of mouth as one of our types of recruitment. So the word of mouth recruitments are pretty priceless. If we go down to number of direct interviews, we did have 3. Agency interviews, 2. Our agency is pretty stable. There's not a whole lot of movement with that. Positions offered, 3. Positions accepted were 3. 6 total may hire. Some of the interviews happened the month before, so it's kind of, but numbers wise, we did have 6 hires in May. Hired higher than a step 3 was 1, and that was a RN was requesting more money. We did, for resignations, we did have 3 very part-time CNAs leave, or basically not come back from an educational leave. They either graduated from high school or college and moved back to their hometown or took employment in their course of study. And we had 1 part-time homemaker. She was a college student and she moved back to Minnesota. So then the open positions would be adjusted as such. No great changes in there from last month. Some of the hiring and the people leaving just kind of evened it out. Work comp lost hours, again, another month without any lost time injuries. And for a very positive, we did not have any staff positive for COVID in May. So there was no lost COVID hours by staff in May. So it was pretty short, easy month for me.
Wow, that's the first time since.
It has. We did not have any. I mean, we had people that were a little symptomatic and whatnot. I've stopped counting those because we could have people that are symptomatic because of seasonal allergies. So kind of relating that to COVID is kind of like some gray area to me. So I've stopped reporting on that and only have started reporting lost time due to COVID positives. And which for the month of May, we did not have any positive staff.
Okay, questions, Sheila or Gordy?
No questions.
Okay, so that means you're hearing everything okay?
I'm hearing everything fine.
Thank you. Okay, Chris, did you want to talk about the CNA training program?
The CNA training program, kind of status quo on that one. They're still having training. We just started a new class this week. I think there's 12 in that class because it was full. I tried to get one of our new hires into it. And then this past Friday, we graduated 10. I haven't had any movement towards applications, because it's kind of a casserole of facilities that are sending people to the CNA class. So we could have people from Dove Healthcare taking the class here. Well, probably not Dove, but other nursing homes in the area sending them to that class. So it's not all just neighbors, employees doing the class. But it's a good recruitment tool to have them in the building because they see how we operate, and a lot of times that they're impressed and will apply or eventually come to us. So
I would think that maybe when they go to a different nursing home, it's possible they see the contrast.
they do, yeah.
Because we have a fantastic place. Well, thank you. Any questions, Supervisor Wolf or Story?
I would, along, if I could offer,
Yes,
I
please.
would just say, just anecdotally, I ran into former supervisor Brian Johnson earlier this week, and he was saying that his has a relative there, and they're just so impressed with the care that the person is receiving. So
Thank you. All right, Chris, anything else on
Nope.
6? No? And Scott's not here? I think we have made it down to number 7. Consideration for action to be taken by the committee, review of vouchers and financial reports.
Well, that's in record time. I'm glad I was here today on time. Oh,
Okay, thank you, Jane. That we're looking forward to here now.
okay. So the first report in the packet, I believe, is the campus aging summary. And it's a little higher, climbing higher, partially due to the Change Healthcare issue earlier in the year. That was a nationwide outage of service for sending claims and receiving payments. So this is the aftermath of that. We're working on it. I do have some staff turnover, so I'll be more hands-on in this area, and we'll be getting that aging back down shortly. And then, any questions on that?
No, it doesn't look like it.
Okay, the campus census is steady. Medicaid is still our biggest payer, and we have a good reimbursement rate for that, so that's good. VA is healthy, and it's a good balance. It's kind of what we projected. So as far as the split, private pays a little higher, but changes happen. So it's early in the year.
As far as the Medicaid bar, do we have that set for 8 households?
That's set for 8 households that are full. So the second household in Central is half full right now. So but we're still having that vacancy, and private pay is higher. There's some Medicaid pending, which will flip back. So you might see some differences in previous months as those get approved.
Thank you. Supervisor Story, do you have any questions? No? Thank you, Jane.
Okay, then on to the financial report. It's a little different than last month. The depreciation hasn't changed. I'm looking at the bottom number, the net without depreciation, that 381,087, kind of in the middle of the page under the 2024 projected. With that amount, it's close. So I think we're on target to what we budgeted, and it's not a dramatic swing. So I think we're on target to be even at the end of the year,
Okay.
all told.
Supervisor Story, do you have that, the budget in front of you? Okay. She's referring to the projected final profit loss.
Exactly.
Yeah,
Yep, it's close to what we budgeted, which is a break even scenario. Of course, it's still early in the year. Medicaid revenues are coming in, they're high. That's good. So everything looks positive right now.
thank you. I know I compared the March, April, May expenses, and the only difference is the depreciation. I mean, they're looking good. We
Yep.
can control them.
Yep. And we have the van, the new bus in there, and we've got that paid for. So that's with all the donation money and some grant money. So that was perfect. And then we have the east, west, and central breakouts that we don't generally go through, but central would be the one that is a little behind because it's not full and it still has the overhead costs charged to it. So that would be normal. And then if we go on to it's labeled page 4 of 5, the breakouts of the staff financial reporting. I don't see a big decline in agency staff like we projected. I think we're getting there, and Chris can speak to that if we need further examination, but I just don't see the trend of it going down like we were projecting. That's the only change that I see. But all in all, I think the staffing is what we budgeted, and so that's looking stable.
I'm curious if Chris or Jane, you have any idea why, you know, with all the people that we thought we might get from the different closures, why it hasn't helped?
The people that we got from the HSHS closures were pretty much all registered nurses. Since hospitals typically do not have very many CNAs, and that's the majority of our agency cost is CNAs. I will also speak to what I think is the wave of the future. I think agency is the wave of the future. I think all of the direct caregivers like the agency. They like the 13-week assignments here. You know, take a couple weeks off, take a 13-week assignment here, take a couple weeks off is kind of the trend. It's not that we're, you know, not attractive to CNAs. It's a supply and demand issue. There just isn't enough of them. So, and the ones that are available are working through agency. Every once in a while, we do get somebody that is quite local working through agency. Superior, I think we have somebody from there. Rochester is, you know, kind of getting a little closer. So I just kind of think that's the wave of the future for direct care workers.
It's interesting you mentioned that. I have the children of more than one family are nurses. And they don't want to work in one spot. They've been all over the US already. And they love it.
Mhm.
And they take time off, like you said.
Mhm.
So
I
interesting.
mean, you also have the people on the flip side of that do not want agency just because you don't know what you're getting yourself into. Because if you stay in one spot, you know what you have, you know, because you could be sent somewhere not so nice. So, I mean, it kind of goes both ways, but I just get the vibe that the wave of the future is the agency or the temp contract gig type
Okay.
employment. So.
Okay, thank you. Chris, you had,
Oh, I was just gonna say, if you look at the bottom of page, it says 4 of 5 on those staff financial piece. If you look at the very bottom right-hand corner, the total 2024 projected, which combines both agency and county staff, it projects us at 10 million, just a bit over 10 million. Weird when you say a tiny bit is 119,000, but that would not be a tiny bit in my personal budget. But it's just a bit over $10 million. And then if you look at we budgeted for about 9.8 million. So it's running about $300,000 over budget, but it's running about almost $800,000 under what our actual was in 2023 and similar to our 2022 number. And the difference in the total financial picture would be that our rates are much higher than they were in 2022. So even though we're absorbing a little bit of extra cost yet in agency staff, our rates are higher and doesn't have quite as dramatic an impact for us as it did in the preceding 23 and 22 years.
Okay, and I see the 10.119 million. And then when you said the budgeted, you're adding together the,
Now, if you go back to the kind of the middle of that bottom row, it says 2024 budget. We budgeted 9,783,653. And then the year, it shows you the column before that, shows you the actuals for 2023, 22, and 21.
thank you.
Question.
Question from Supervisor Story. Yes.
Not so much. I mean, there's so many moving pieces that it's really hard to kind of attach serious meaning to any one particular moving piece. In 2021, we would have had everything open, right? Am I right?
No, it was COVID.
It was COVID, but we had all of our houses open, right?
I don't think,
No.
When did we close Central? In 21?
1 to 2 were closed.
Yeah, then the
Are
second
you
one.
catching that, Sheila?
Yeah.
Okay.
Yeah. So, yeah, so, that certainly could have some influence, Sheila, as you say that.
Workers from all around the United States, don't we really have to pay more money for that?
Oh, absolutely.
Yeah. So,
So you pay a salary and, salary and fringe cost, and then you pay an administrative fee to the agency that does all the processing of their employment. So, yeah, it's they're paid significantly or paid more because their travel and they're paid a per diem and a higher rate of pay to accommodate for their travel. And then also we pay an administrative fee on top of that.
thank you.
Okay, thank you, Jane. We were at, okay,
So we're done with the payroll piece. Then let's move on to page 5 of 5. The senior meals report, we didn't get the May data in there for revenue, but of course, as expenses show up, that's even, it's healthy. What we're doing with that is readjusting the payroll. We are not assigning enough payroll to that, to senior meals. People who are actually working that their payroll isn't getting assigned to that department. So there'll be some adjustments coming up next year or next month, and a higher expense to match that, and that would be more accurate than we're fine tuning some of the payroll assignments. But senior meals is good. They're producing a lot of good stuff for ADRC, and it seems to be going well. Depreciation, we worked on that yesterday, so next month you'll have numbers in there. As expected. We had some glitches in the computer system, of course. So that will be populated. Then moving on to the vouchers. Any questions on the vouchers?
Supervisor Wolf, did you have any questions looking at this? Supervisor Story, do you have any questions on the vouchers? I think you nailed it right there. Okay, so Jane, that's
That's
all for you?
all I have today.
Okay, then I guess I would look for a motion to accept the vouchers and financial report. Supervisor Story moves and Supervisor Wolf seconds. All in favor? Aye. And it passed. Is there anything else, Ms. Corpola, that you would like to say?
No, I think we're going to muddle our way through until Carmen shows up. We are going to competently continue to have a high-class organization, high-functioning, well-functioning, high-class organization until Carmen returns.
Okay, and I think next time we will probably have more people here, and then we can go back to a little bit of education, and then we can, in July, do the budget. Is that what you're thinking?
I think that would be a good plan.
Okay, the fourth Thursday of July is our next meeting at 9 o'clock. And
We will also have in July, we will also have the audit report for 2023
okay,
from our county auditors.
okay. Anything else, Supervisor Wolf or Story?
Oh, I just promise I won't break another arm.
I'm planning on being in New Orleans between the 22nd and the 29th of July.
But you're, yeah, just so.
At this point, I'm planning on being in New Orleans between the 22nd and the 29th of July, so it would probably have to be via Zoom or however.
Huh, that'd be great if you can, and if you can't, just let us know so we make sure we have a quorum.
All right, thank you.
Anybody else? Then we are adjourned.
Bye, everybody. Bye, everybody.
Bye, Sheila. Now, you knew that Sheila fell and broke her arm? She broke it towards the top